Hey, this is Don Walters coming to you from www.theclinicaltrialsguru.com. Hey, my buddy Dan and I were watching a video the other day by Pfizer, and this, I believe, was a recruitment video. And this video, they were recruiting, or they were trying to recruit people who were diagnosed with schizophrenia and who had predominantly negative symptoms over the positive symptoms. Again, it was a video that was very professionally done and presented very well. The issues that I had with that video, and I thought that they could have changed things a little bit, was that I thought they missed the mark. When the video first started, I wasn't sure whether they were targeting the patient or the doctor. But then, as they went on, it let me know they were targeting the patient. But what I found to be wrong, one of the key things to start with I found was wrong, was the terminology they were using. Using terms like negative symptoms. The average population is not going to know what that means, as well as someone who's diagnosed with the illness of schizophrenia. They're not going to know what the term negative symptoms. They don't know what negative or positive symptoms are. And then you're asking them to write down the number to the study and ask their doctor for that. Well, if they got a lot of negative symptoms, number one, you're talking to somebody that may not have it, and there's a few do, but a few don't. Now, the reason I'm responding to this, I've been working in Southern California in about 3 to 4 different counties. Let's see, Los Angeles, Orange County, San Bernardino County, Riverside County, and some of San Diego County for the past 10 years, working with this population involved in research. And the type of clients that we look for with negative symptoms are usually not people who are highly motivated. You usually have to seek those people out. And you might find a few from time to time, and I can think of one that they are looking for studies. They're out there watching TV, and as a matter of fact, this person used to be on the computer at one time, but not anymore. She's getting older, and I think there's some other, she's starting to lose a lot of her ability to stay, motivated with those type things. But when you start using terms negative symptoms and asking them to write that down, the study number and contact their doctor and stuff like that, you're actually putting a lot on their plate. They're not definitely going to know what negative symptoms are. And I guarantee if I walk out my door right now and met somebody on the street and asked them, and someone diagnosed with schizophrenia, do you know what negative symptoms are? Or if I went and walked over here and asked one of the patients who are diagnosed with schizophrenia, I guarantee you they're not going to know what negative symptoms are. Again, as I reiterated, the study was very professionally done, but it was just that I felt they missed a mark. When addressing this population directly, you're going to have to use what Dan and I call plain talk. And instead of saying negative symptoms, be descriptive of what culminates negative symptoms. Use a few of those things and just ask that person, are you experiencing A, B, and C? And if you are, and you're diagnosed with schizophrenia, please give us a call. Now, they gave you the number, which was great, and a website, which was great. And just call this number. And I think you're going to get a better response from that, because that's not putting too much on that clientele. They'll pick up that phone and say, hey, look, I saw you on TV. And you take it from there. But anyway, with that said, again, you've got to address these people in plain talk. And when you start using terminology that's clinical terminology, you lose them every time. You're not going to get them that way. At least I know the population that I've worked with here in Southern California, you're not. I'm not sure how things are set up, in other parts of the country. So I can only speak for here. Again, this is Don Walters with www.theclinicaltrialsguru.com, and I hope that helps. If there's anybody out there if you have any input on this issue, please let us know. We'll be glad to hear from you, because we just want to share this information with the world. We're all trying to make things better and be better ourselves. Also, too, if you have any questions or if you need any help in that arena, just contact us, and Dan and I will try to research and find an answer for you. Again, that's Don signing off from theclinicaltrialsguru.com. Take care.